Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I'll give a brief overview of what you need to know about Parkinson's disease. In particular, I will cover what is Parkinson's disease, how you treat it, and how you can live better with Parkinson's disease. So we start with what is it? Parkinson's disease is a chronic or persistent condition of the brain that affects about 6,000 people in Ireland. Parkinson's disease affects the way the brain coordinates body movements, including walking, talking, and writing. It affects both sexes, although statistically men are slightly more likely to develop the condition than women. When the symptoms of Parkinson's disease occur between 21 and 40 years of age, it is known as young onset Parkinson's disease. The symptoms of Parkinson's disease vary from person to person. Early signs may be subtle and can go unnoticed for months or years. Symptoms typically begin on one side of the body and usually remain worse on that side. Parkinson's signs and symptoms may include tremour. So this is the characteristic shaking associated with Parkinson's disease, often begins in the hand. A back and forth rubbing of the thumb and forefinger, known as pill rolling, is common. Slowed motion or bradykinesia. Over time, Parkinson's disease may reduce your ability to initiate voluntary movement. This may make even the simplest tasks difficult and time-consuming. Rigid muscles. So muscle stiffness often occurs in your limbs and neck. Sometimes the stiffness can be so severe that it limits the range of movements and causes pain. An impaired posture and balance. Your posture may become stooped as a result of Parkinson's disease. And loss of automatic movements. So blinking, smiling, and swinging your arms when you walk are all unconscious acts that are a normal part of being human. In Parkinson's disease, these acts tend to be diminished and even lost. The speech changes, so many people with Parkinson's disease have problems with speech and dementia. In the later stages of Parkinson's disease, some people develop problems with memory and mental clarity. Many symptoms of Parkinson's disease result from the lack of a chemical called dopamine in the brain. This occurs when the specific brain cells that produce dopamine die or become impaired. But researchers still aren't certain about what sets this chain of events in motion. When 80% of the brain cells have been lost, the symptoms of Parkinson's disease will appear. Over time, the level of dopamine will continue to fall slowly, and symptoms will become gradually worse. So risk factors for Parkinson's disease include your age. Young adults very rarely experience Parkinson's disease. It ordinarily begins in the middle or late life, and the risk continues to increase with age. Heredity. Having one or more close relatives with Parkinson's increases the chance you'll also develop Parkinson's disease, although your risk is still less than 5%. And recent evidence suggests a crucial role for small contributions from many different genes that program brain architecture. Also sex. Men are more likely to develop Parkinson's disease than women. And exposure to toxins. Ongoing exposure to herbicides and pesticides puts you at slightly increased risk of Parkinson's. There are no tests that you can definitively prove that you have Parkinson's disease. Your GP will base the diagnosis on symptoms you are experiencing, your medical history, and the results of a clinical examination. In the early stages of Parkinson's disease, because your symptoms will usually be mild, your GP may find it difficult to say whether you definitely have the condition. You may be referred to a specialist if your GP suspects you have Parkinson's disease. So next is, how do you treat it? So first is medications. Medications can help manage problems with walking, movement, and tremor by increasing the brain's supply of dopamine. Taking dopamine itself is not helpful because it is unable to enter your brain. So levodopa, the most effective Parkinson's drug, is levodopa, which is a natural substance that we all have in our body. When taken by mouth in tablet form, it passes into the brain and is converted into dopamine. So levodopa is combined with carbidopa to create the combination drug Sinemet. Dopamine agonists. be the next drugs. Unlike levodopa, these drugs aren't changed into dopamine. Instead, they mimic the effects of dopamine in the brain. They are not nearly as effective at treating symptoms of Parkinson's disease. However, they last longer and are often used to smooth the sometimes off and on effects of levodopa. Next is MAO-B inhibitors. These types of drugs help prevent the breakdown of both naturally occurring dopamine and dopamine formed from levodopa. Next, catechol O methyltransferase inhibitors, or COMT inhibitors. These drugs prolong the effects of carbidopa and levodopa therapy by blocking an enzyme that breaks down levodopa. Next is anticholinergics. So these drugs have been used for many years to help control the tremor associated with Parkinson's disease. And next is antivirals. Doctors may prescribe Semetril alone to provide short-term relief of mild early-stage Parkinson's disease. And next is physical therapy. Exercise is important for general health, but especially for maintaining function in Parkinson's disease. Physical therapy may be advisable and can help improve mobility and range of motion. And finally, how do you live with Parkinson's disease? If you've received a diagnosis of Parkinson's disease, you need to work closely with your doctor to find a treatment plan that offers you the greatest relief from symptoms with the fewest side effects. Certain lifestyle changes also may help make living with Parkinson's disease easier. So, eating healthy. Eat a nutritionally balanced diet that contains plenty of fruit, veg, and whole grains. These foods are high in fibre, which is important for helping prevent constipation that is common in Parkinson's disease. Walking with care. Parkinson's disease can disturb your sense of balance, making it difficult to walk with a normal gait. So these suggestions may help. Try not to move too quickly. Aim for your heel to strike the floor first when you're walking. If you notice yourself shuffling, stop and check your posture. It's best to stand up straight with your head over your hips and your feet 8 to 10 inches apart. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing Parkinson's disease more effectively on a day-to-day basis. So to start with, we have numerous products to get you started on a mild exercise program, such as floor mats, weights, and various other items you'd need to do mild exercise and range of motion exercises. We also have various supplements which you can buy from us without a prescription for Parkinson's, such as multivitamins and fish oils. We also provide you with a Make Your Home Safe guide, plus psyllium husk, and we also supply assisted living devices such as canes, walkers, raised toilet seats, devices to prevent you falls and protect your joints, grab rails, non-slip mats, etc. And we also have light boxes to promote relaxation, and blood pressure monitors and blood sugar monitors. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. If you book a 30-minute clinic with us, we help you to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing Parkinson's with confidence. We provide you with the tools you need to live a healthy life. So call into us at Lynch's Pharmacy in Douglas and Cork, or ring us 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.